Hello and happy Friday. There was a recent survey by the American Medical Association, or the AMA, that was looking at physician burnout, and the results were actually quite concerning. Now, the AMA is the largest association of physicians in the United States. It represents all physicians, all areas of the country, all different disciplines. So when they come up with some conclusions, that has a great deal of evidence behind it, and it actually has a great deal of gravitas because of some of the conclusions they can come to. Now, what the AMA found was, in their survey done in conjunction with Stanford and Mayo, was that in 2021, 62% of physicians were showing significant signs of physician burnout, and that number was only 38% the year before. In addition, 1 out of 5 physicians plan on leaving their job in the next 2 years, and even worse, 2 out of 5 nurses. So we're actively seeing people leave medicine or just plain retiring. In addition to that 1 out of 5 physician number, actually 1 in 3 in addition are actually going to cut their hours. So we've already seen this, the idea of getting in to see doctors, the appointment times, the wait lists, all of the time you're actually allowed with the physicians, all of that is decreasing. And these physician shortages are actually going to make this worse. Now, the AMA also wanted to look at why this was happening, and they found a couple of simple things. Number one, of course, it's a greater hassle for us to do our jobs. There's more checklists and requirements and kind of pre-authorizations. There's all kinds of impediments for us to be able to do our job efficiently and truthfully happily. Number two, we're actually seeing a little less support from the administration. They're under their own pressures, and that does trickle down to the physicians. Number three, unfortunately, we've seen politics get in the way of medicine, and the last couple of years that has been highlighted, whether it's COVID or just other aspects of politics in general. Number four, we're actually seeing more disinformation being out and placed out in the market. Again, we're trying to work through things like COVID and mask wear and things like that, but there has been some active disinformation along the way that has undermined the ability for science to just come forward. And so, with all of those in mind, the AMA has kind of put together a couple of different ideas of where to go from here, but they have to be systematic. They can't be just something we're saying, we're going to make their lives a little bit easier by bringing donuts and coffee into the workplace. We need to work with insurance. We need to work with the healthcare system. We need to work with Medicare, unfortunately. And yes, we still have to work with government to be able to get all of this done. But the idea is that we really need to make some systematic improvements because honestly, our workforce is going to start thinning out, and truthfully, our work and our health is going to suffer.